Hi folks, Dr. Ed Beyer again. Today we're going to talk about reason number 11, why you have low thyroid and your doctor's not figuring you out. Okay, that's one of the most common things I see, especially from our female patients. I'm tired, I'm losing my hair, I'm gaining weight, I'm depressed, my gut doesn't work right, on and on and on and on, or cold all the time. And they go to their doctor, they look at their TSH or T4, you're within lab range normal, and nothing's done. There are so many ways your thyroid can go wrong away from the gland, and this is one of them. And it's due to high homocysteine. Homocysteine is a breakdown product of our proteins. We all have it in our blood, but when it gets elevated, and what I mean by elevated, I mean above 7 in your blood, what high homocysteine does is it literally blocks T3, which is the active form of your thyroid hormone, from getting into the cells. We call that receptor site resistance or thyroid resistance. High cortisol, high estrogens, inflammation, and bad oils, okay? Omega-6 oils will do that also. Now, why would your homocysteine be elevated? In order to metabolize homocysteine, you need adequate amounts of activated B6, B9, folate, and B12 in the body. A very common reason why we see a deficiency in those 3 B vitamins is this genetic defect. This is the #1 genetic defect in our country. MTHFR is an enzyme that activates our B vitamins. When we eat our B vitamins, folks, they are not active. They're not active, and nor are they if you take shots or supplements. They need to be activated. This is the enzyme methylene tetrahydrofolate reductase that does this. And many people are not making enough of that enzyme because they have a genetic defect. We test our patients for this. If they have it, the story has a happy ending. We give those people specially formulated, already activated B vitamins, lowers their homocysteine, and improves thyroid function. A poor diet, obviously, if you're not getting enough B vitamins in your diet, but B vitamins are in everything. And so what we commonly see is not enough stomach acids or hypochlorhydria causing poor absorption of your B vitamins. That we see quite commonly. Once we improve the absorption, and then we can lower homocysteine. And homocysteine gets metabolized mainly in the liver. So if the liver's not working, that's another reason for elevated high homocysteine and thyroid resistance. Folks, if you're suffering from a chronic fatigue, you think you have a thyroid problem, you really need to be able to go to someone to identify the root causes. This is one of many. As I always say, there's multiple pieces to the thyroid dilemma. This is one of many. I'm Dr. Beyer. Have a great day. Hope this helps.